In today's episode, we are focusing on one of the biggest operational changes currently shaping general practice, the evolving role of care navigation, and how it is transforming the way patients access healthcare. Across primary care, the way patients interact with their GP practice is continuing to change. Increasing demand, workforce pressures, and the growth of multidisciplinary teams have encouraged practices to rethink traditional access models and focus on ensuring patients receive support from the most appropriate professional at the right time. Care navigation has become a key part of this transformation. Rather than every patient journey beginning and ending with a GP appointment, practices are increasingly using trained teams to understand patient needs, identify the most appropriate pathway, and connect individuals with the right service. For practice managers, this represents a significant opportunity to improve patient experience and make better use of available workforce capacity. However, successful care navigation depends on more than simply redirecting patients. It requires strong processes, confident teams, and clear communication. One of the biggest challenges is ensuring that care navigation is viewed positively by both patients and staff. Patients may initially feel concerned if they are offered an alternative route instead of automatically receiving a GP appointment. This makes communication essential. Patients need to understand that care navigation is designed to improve access, reduce delays, and ensure they receive support from the most appropriate healthcare professional. Reception and administrative teams are central to this transformation. The traditional perception of these roles has changed significantly, with staff now playing a much greater role in supporting patient journeys, identifying urgency, and helping people access the right services. This increased responsibility highlights the importance of training. Staff need confidence in understanding available services, recognizing potential risks, and knowing when escalation is required. Effective care navigation relies on teams having the knowledge and support to make appropriate decisions. Another important consideration is consistency. Practices should ensure that all members of the team are working from the same guidance and processes. Inconsistent approaches can create confusion for patients and increase pressure on staff. Data also plays an important role in improving care navigation. Reviewing appointment demand, contact reasons, referral patterns, and patient feedback can help practices understand whether pathways are working effectively. This allows leaders to make improvements based on evidence rather than assumptions. Technology continues to support this transformation. Digital telephony systems, online consultation platforms, and patient access tools provide opportunities to improve navigation and create more efficient workflows. However, technology should support staff rather than replace the human interaction that patients often need when contacting their practice. Care navigation also links closely with the wider development of multidisciplinary teams. As more healthcare professionals become involved in primary care, practices need effective systems to ensure patients are connected with the right expertise. This supports better use of workforce skills while helping protect GP capacity for patients who require medical assessment. For practice managers, successful implementation requires strong leadership. Teams need to feel supported as roles evolve, and leaders must create opportunities for feedback, learning, and continuous improvement. The future of general practice will increasingly depend on intelligent use of resources. Care navigation is not about restricting access. It is about improving the journey patients take through the healthcare system. Transformation Tuesday reminds us that modern primary care is changing from a system focused on appointments alone into one focused on coordinated pathways, appropriate support, and personalized care. By investing in training, communication, and effective processes, practice managers can help create access models that work better for both patients and teams. The General Practice Manager Register continues to support practice leaders by sharing practical insight into emerging developments, encouraging collaboration, and strengthening leadership capability across primary care. Thank you for joining us for this week's Transformation Tuesday from the General Practice Manager Register. We look forward to welcoming you again next week.